For those who don't know me, my name is Donna McKay, and I'm the Executive Director of Physicians for Human Rights. I'm told that we have over 1,000 registered for today's call, and that's a good deal of people. I know a great many of you who are on the call as our organizational and foundation partners, clinicians who are in part of PHR's U.S. Volunteer Asylum Network, and many, many health professionals and first responders who are today on the front lines of this pandemic amidst shortages in personal protective equipment, increasing rates of infection, while being separated from their families and to protect their loved ones. And so before I say anything else, especially for you, we want to extend our enormous gratitude for what you are doing. Before I turn it over to Dr. Saltz and Dr. Sulkowicz, I want to give a shout out to my PHR colleagues and the staff and the many volunteer and board members. As this crisis has escalated in the last several weeks, the expertise and insight of PHR and our network of clinicians has been in extraordinary demand, more than any time, I think, in our history. We're fielding nonstop requests from the media for expert analysis on the pandemic's impact, and particularly on people in vulnerable situations such as prisons and immigration detention centers, and responding to a great number of requests for collaboration and consultation from partners in the global nonprofit and advocacy sphere who are looking for expertise of health professionals for their legal and other policy efforts. So PHR's health worker network and NGO partners has stepped up in extraordinary ways. And so today, really, we provide this session for you. One of the most common phrases I hear today in response to questions to our expert scientists and healthcare workers about COVID-19 is, we just don't know. And it's true that, you know, one of the underlying contributors to our heightened anxiety, which we have to manage, is we care for our families and manage our work. And for many of you, diagnosing and treating patients is that underlying unknown. So I want to turn to our speakers. We're very fortunate at PHR and very proud to have board members that make up some of the world's leading medical, legal, and scientific minds who offer invaluable perspective on human rights issues. And so we have two of them here today. And lastly, though, before I turn it over to my colleagues, I want to say that we welcome your questions throughout the briefing today. So you can send them while our speakers are talking to webinar@phr.org, webinar@phr.org, and we'll do our best to address them. Dr. Kerry Sulkowicz is a PHR board member and former board chair of the organization, is a psychiatrist and a psychoanalyst, is founder and managing principal of Boswell Group in New York. He advises CEOs, management teams, and boards on leadership and culture, particularly important right now, right, as institutions of all kinds are trying to navigate their teams through this crisis. He is on the faculty of the Psychoanalytic Association of New York and is a clinical professor of psychiatry at NYU School of Medicine. And as president-elect of the American Psychoanalytic Association, Dr. Sulkowicz has been helping to lead the rapid swift of the Mental Health Association's members to adapting to the virtual work environment this pandemic has led to. Kerry's been talking quite a bit about the second pandemic, the pandemic of anxiety. And we also have with us Dr. Gail Saltz, who is PHR board member. Dr. Saltz is a clinical associate professor of psychiatry at the New York Presbyterian Hospital Weill-Cornell School of Medicine, and a psychoanalyst with the New York Psychoanalytic Institute. In the past few weeks, you may have seen Gail. She's appeared numerous times and widely being interviewed by members of the media on managing anxiety around the pandemic and providing just practical guidance in terms of structuring the day and talking to children and staying connected with loved ones. So I'm going to turn the conversation over now to Dr. Sulkowicz and Dr. Saltz to address the more depth, the mental health implications of COVID-19. And I'm going to turn off my video right now so as not to distract, but I'll join back at the end. So Gail and Kerry, I turn it over to you.
Thank you, Donna, for the warm welcome. It's great to be here with Gail, and it's great to be here with all of those of you who've joined online here, the broader PHR community. We're happy to be with you, albeit under some very challenging circumstances. Gail and I are going to say a few things at the outset here and then really have a conversation with each other and try to answer your questions. So hopefully this will be a kind of virtual conversation with all of you. There's no way that we're going to be able to cover all of the questions that come up or all the possible areas of concern, but we will certainly do our best to talk about what seems really important. As Donna mentioned, I've been talking a lot over the last 2 weeks with leaders of different kinds of organizations to try to help them navigate their organizations, their individuals and their organizations as a whole through this unprecedented crisis. And one of the ways that I have been trying to frame the issue for people, and I think this is not just applicable to leaders, but really to everyone, is to say that it is really two pandemics, not one. There's obviously the pandemic of the coronavirus, but there's also a pandemic of anxiety. And I think it's important to think of it that way. That is not just a figure of speech or a metaphor. I think that there is widespread high levels of anxiety throughout the world. Different people experience it and manifest it in different ways, but it is something to be content with. And I think it's so important to heighten awareness about this aspect of the crisis that we're going through, in part because the two pandemics, as I'm referring to them, fuel each other. Clearly, the pandemic of the virus is one of the major sources of anxiety. People are afraid of getting it or afraid of some of the many terrible consequences of the virus. But it works the other way too, in the sense that the high levels of anxiety can lead, in ways that I'd like to get into in just a moment, can lead to an actual worsening of the virus if we're not aware of that and doing things to actively try to mitigate that. So it's really the anxiety part that I'm going to be focusing on, and that Gail and I will both be trying to talk about. There are a few ways that I'd get into the pandemic of anxiety. First of all, in terms of what are people anxious about, it may be stating the obvious. Obviously, the virus itself is one of the things that people are very anxious about. I think people are very anxious about the dire economic and social consequences that are going on, that we're seeing dramatically all over the world today, and that unfortunately will probably get worse in many parts of the world before they hopefully start to get better. And a third source of anxiety that I would label, although there really are many, is the uncertainty itself. I've been asked in a number of the conversations that I've had over the last couple of weeks how this compares to other kinds of global catastrophic events. For me, living in New York, 9/11 is one that comes up a lot. And I would say that in no way to diminish the significance of other global events that have been disastrous, this one is different in some significant ways. And one of the main ways is that an event like 9/11, or an event like an act of nature, a hurricane or a terrible storm, those events happened on one day. And of course, the aftermath in many cases took years to recover from. So I'm not diminishing the severity of those, but this, unlike some of those one-day events with long aftermaths, this one is still unfolding, and we really don't know how long it's going to continue for. So I think that makes it in some ways more like dealing with a warlike in some regards, in that it's like dealing with an unseen enemy, and it's hard to gauge exactly how it's going to play out. That's another source of anxiety. I tend to think of anxiety as existing on a spectrum, and somewhat crudely defined. If at one end of the spectrum is outright denial, putting one's head in the sand, as the saying goes, if denial is on one end and then there's sheer panic and hysteria on the other, I think it goes without saying, but it is worth saying that those extremes are not helpful. They're not adaptive as ways of coping with what we're going through right now. And somewhere in the middle, although it's hard to locate the middle exactly because of the shifting and evolving nature of this crisis, but somewhere in the middle is what I would describe as an appropriate level, a high level of appropriate concern and anxiety. And I think that level of concern is adaptive because it can actually fuel us to take the appropriate measures for public safety and public health. I am seeing, unfortunately, people, not just in leadership positions, but throughout society, at the extremes of denial on one hand and panic on the other. And I think that we can talk about this more as it goes on, but I think that by raising awareness about these ways of coping, we can hopefully get people to be more self-aware and then aware of the people that they're concerned about, and trying to take care of levels of more maladaptive anxiety. Why is it important to be on top of one's anxiety? Again, it may sound like I'm stating the obvious, but I think there are a few things that we need to be quite conscious of. One is that anxiety, and this is well known, anxiety affects our cognitive abilities. It affects our ability to think clearly. And one important aspect of that is it affects our ability to perceive reality accurately. And if you think about that for a moment, it's so clear, I think, that being able to think clearly and perceive reality accurately are essential for being able to make sound decisions. This is not just for people in leadership positions, it's for all of us who are making day-to-day decisions about ourselves and those around us, the patients that we take care of, the groups that we serve. So one of the major effects of anxiety is that it can compromise, if we're not tuned into this, our ability to make sound decisions. Another really critical effect of anxiety is that it naturally, understandably, focuses our mind on what is right in front of us, on the immediate and the very short term. It tends to block out thinking a bit more long-term, thinking more into the future. And I think that I want to raise awareness about that because it is so important now that while sure we do need to be taking care of making sure we have food on the table, that we are safe, that basic immediate needs are met. We clearly need to be attending to that, but without also having one eye, if you will, on a longer term future, we are going to be missing out on opportunities to learn from what's going on. We're going to be missing out on opportunities to plan for the eventual recovery. Excuse me. We're going to be missing out on a kind of empathy that we need to be maintaining while taking care of those immediately around us. We need to be thinking about those who are a lot less fortunate than some of us and who are in situations around the world where there are dire economic circumstances, dire health circumstances, and we need to be able to think and pay attention to the needs of others beyond our immediate circle. And finally, I think one of the reasons why I think it's so important to keep an eye on the future, and this is really an emotional aspect, very relevant for people who are in positions of leadership or authority, and that is that we need to be talking not only about the immediate term, but the future, because that is a way of giving hope. And hope is in pretty short supply right now. And so I think to be able to keep one eye on the future is a source of hope. I would be quick to add that I'm talking about genuine hope that is rooted in reality. I think one of the problems that we are seeing in the world today is some abject failures of leadership in all sorts of places, government and elsewhere, in which we're hearing leaders who are trying to give hope in the absence of being grounded in reality, and that is falling short, to say the least, and is coming across as inauthentic and not genuine. So we'll get into a lot more detail, I think, as Gail and I continue to talk, but I'm going to take a breath there and hand it over to Gail.
Thank you, Kerry, and I'm happy to be with all of you today. I'm going to add to Kerry's statement that we're having pandemic anxiety as kind of a diagnosis, and look at really diagnostically what would psychiatrists say in a DSM-5 sort of way about what is happening now. And really what we're having is an adjustment disorder, because there is an active thing happening. So in other words, this is not anxiety or sadness related to our day-to-day usual or something biologically happening in our brains. This is a reaction, our brain's reaction to what is actually occurring around us. And the treatment for adjustment disorders in general are not usually medication. They are usually some sort of psychotherapy, some sort of being talked to, being listened to, etc. And one thing that is so compounding about this current adjustment disorder internationally is that our ability to talk to each other and to be listened to is really being impeded by the fact that one of the treatments for this pandemic is this social distancing. And so I think that many people are finding themselves with unusual amounts of not only anxiety and fear that they're not used to having, but also sadness, loss, grief, loneliness, you know, at least in this country, up to a quarter of all people live alone. And the social distancing that we're needing to do, that we must do now in many ways, makes dealing with these various kinds of emotions and doing the kind of care that we would advocate for, and for people who already probably struggled with loneliness. Many of you are probably aware we really have a public health crisis growing already before this started in terms of loneliness. It's being exacerbated by what's going on. And in that vein, I think that it's hard in light of the realities of what's happening, but everybody has to think of making some priority out of self-care. And that's hard to do when you're thinking about people becoming sick, how do I make money, how do I take care of my family, etc. But to some degree, it is all about putting your oxygen mask on first before you can completely help others. And so I'm talking on the micro level of you individual day to day, and I'm talking on the macro level of organizations, hospitals, healthcare workers. And that is very, very challenging right now, and not something people think about wanting to do. But I would say that for everyone to be helped maximally in this utilitarian way, that self-care is extremely important. And often the things that we're talking about in terms of self-care seem so simplistic that it maybe is something that people want to put aside and say, no, that doesn't sound sophisticated enough to really help me. But I would say that actually these are tools that are very research-backed, et cetera, and people do need to think about dipping in. So it might be about various coping tools for relaxation, which physiologically can relax your body, which we know then can also relax your mind. So we can talk, if people have questions more in depth about what those would be, but various forms of mindfulness practice or physical relaxation or deep breathing. We know that talk and connecting with others and talking about how you feel is very important, and that even though we're socially distanced from each other, that technology has allowed us to be able to, in fact, connect with each other still by phone, by face, have those conversations, check in on those who need checking in, and talk about how we feel. And we know that treatment is also very effective for people who are experiencing enough of the anxiety or the sadness or the lonely feelings that it's impairing their ability to function in their day-to-day life. And of course, that's been increasingly difficult with social distancing. However, there's been a huge uptick in the use of telemedicine and a huge increase in availability of therapists who are volunteering in New York State, but really all over the world, in app form, in telemedicine form, in phone form, so that people, and we are seeing a huge uptick in people using those services, which is very important right now. I want to just address a special group, which is really healthcare workers, who are used to being trained to deal with whatever situation is in front of them and to the best of their abilities, make a huge difference. And I think that healthcare workers for the first time are in this completely unique situation of such an uncertainty. We had maybe some of that during the HIV epidemic. And I think that this is reminiscent of that in some ways, but for all healthcare workers of all sorts who are at all hospitals in various ways, and is very, it creates tremendous uncertainty, it creates a lot of fear, and it undoes the coping mechanisms that healthcare professionals are used to having, which is that for all of us, actually, those that can contribute and be helpful feel better. We know that that works actually as a coping mechanism. So for many healthcare professionals, in some ways, they're being blocked from the very coping mechanism that they would usually be using. And that is very difficult. And they also don't tend to feel like people who are entitled to ask for help or to need help. They're supposed to be the helpers. And I think that it really is challenging for the identity of many healthcare workers. And it also is putting them in a position with not having the protections that they would normally have, that they feel at risk, and their families, they feel, are at risk. And so this has to be raising anxiety levels and decreasing mood. And so healthcare workers, we really need to think about how, from a mental health perspective, they are getting support, they are being listened to, and they are being helped in whatever way possible. And I also want to just mention that, in addition, the other issue that's been thrown into this mix is the complete transition of lives. Transitions are difficult for everybody. Change is difficult for everybody. And now, with everybody either being out of a job or trying to work from home and having their children at home, unstructured, how do they have education? How do you create space in the place that you have to be all together? Being all together in that way has been very disruptive to many relationships, parent-child relationships, partner relationships. It's been an extra challenge in that sense. And thinking about how you structure your day, how you get enough sleep, how you eat in a healthy way and not turn to alcohol or other substances, how you create corners in your home that people have their own space, and how you still come together to have some joyful moments, some playful moments, how important it is to inject that, to preserve these relationships. And I think that we all, but mental health professionals in particular, are thinking about how to help you with structuring your day, managing change. And as Kerry pointed out, at the end, building these kinds of coping tools is really essentially what builds resilience, so that the possibility exists that, as hard as this may be, as we build these kinds of structures and relating abilities and treatment abilities and self-care abilities, we will emerge from the other end and feel resilient. These are the kinds of things that one is able to look back on and say, well, if I got through that, I can get through this, whatever this is, and be a stronger human at the end. So with that, I guess we will turn to open it up to questions, individual questions.
Yeah, we have a number of questions coming in here, Gail. Before we take a question, I wanted to pick up on the phrase that you used. It as the widely used phrase these days of social distancing. I would say that I think that's a misnomer in a way, because I think a better term is physical distancing, because I think that's what's required for the public health, is being physically separated from everybody, which is from each other, which is what you've been talking about, is resulting in all this isolation. But what we actually need is social closeness right now, even more so. And I think that that's something that I'm sure you would agree, Gail, we want to encourage, is the use of these virtual technologies. I think you were implying this, to remain close, if not even closer than we otherwise would naturally, with our loved ones, our colleagues, whoever's important to us, and to maintain those social bonds. And we're fortunate to have these visual technologies, because I think the loss of the visual that comes from the isolation is going to be increasingly problematic and may result in some of the very kind of psychological problems that you were talking about. So
actually, along those lines, someone asks a question here. I work as a mental health peer specialist in an urban area, and we're able to use remote technology with some people we serve, but some of the people that we serve don't have access to technology. While school children in many places are able to access technology to learn, this may not be the case for vulnerable populations in need of mental health support. Any tips when we can't connect with people via technology? So I would say this. A lot of the rules that were set in place for good reasons, for HIPAA purposes, for confidentiality purposes, because we need some of these regulations. I think in this time, many of the rules are being completely, obfuscated essentially, and for good reason, because so many more people are in need, and some do have the ability to use technology, and as you're pointing out, some don't. So that actually therapists can, you can call someone on a landline. You can, we're actually now able to use FaceTime, Skype. I realize some of this is technology, but in other words, formats that we were not able to use because they were not considered as secure. And of course, I mean, long-term, that would be a concern, but really for the vast number of people that are in need, we're now allowed to use most methods. I mean, not a public forum, perhaps like Facebook, where everybody could see, but other than a public forum like that, psychiatrists at least and psychologists are allowed to use all kinds of formats now. And that's just important for everyone to know, because there are many ways to reach out and connect with, whether it's a mental health professional or your physician. And I would say, you know, they're obviously landlines are old school, but that is a way to do it. There are also groups that are actually coming together and doing sort of social distanced groups. There are ways to essentially volunteer and be part of something in a social distanced way that are occurring in urban areas. You know, we're packing lunches for people that we're going to leave at certain places for families who will need them, et cetera, that sort of thing. I don't know, Kerry, do you have other thoughts on that?
You talked about the need for self-care. That's an important part of it. One of the questions related to what you're raising, Gail, is a question about the people on the front lines who are treating COVID-19 patients. Will they need psychological counseling, some kind of intervention? The first thing I would say, by the way, is the people who are on the front lines of treating these patients are heroes right now, and I think what they certainly need our utmost respect and our gratitude. That's first, and I think that needs constant reminding. Will they need psychological counseling? Of course, it's hard to anticipate, and each person is different. But I think that it's quite possible that there will be some serious psychological sequelae of being on the front lines of this, seeing people dying. Doctors are used to feeling very much sort of in charge of their work and their destinies and doing what it takes to take care of patients. And I think doctors, healthcare workers, not just physicians, certainly all healthcare workers are feeling increasingly helpless in some settings right now, simply because of the conditions and the lack of proper equipment and attention to their own safety. So they are working under extreme conditions. And I think we need to advocate for their safety and protection. Hopefully that goes without saying, but it is worth saying because it is not being heeded in all parts of society. I do think that it's worth reminding everyone here, particularly healthcare workers, that that they are doing what they can do, and we are grateful to them for that. But they also need to take care of themselves in terms of eating healthy, getting exercise, being on a regular schedule. These are simple-minded sounding things, but I'm not reluctant to make the reminder. And certainly to abide by the restrictions, of physical distancing. That's important. And then when they're not on duty, they need to be doing the kinds of things that you were suggesting in terms of being connected with their social groups, the social bonds in society. We're social animals, and the social bonds that we ordinarily take for granted that take place in the corridors of the hospital or in the office, in work and in school and so forth. Those are simply not possible in the way that they were only a few weeks ago. And as this wears on, and unfortunately it's going to wear on for what looks like months, we just don't know, those social bonds risk being increasingly frayed. And so we need to do all that we can to try to simulate those. Again, another simple-minded suggestion, we need to use these technologies. We're using Zoom for this call, not just to have meetings, and to take care of day-to-day business, so to speak, but we need to use these technologies to recreate those social bonds. And so people should have virtual lunches and virtual gatherings, social gatherings, because I think that that connectivity is what's the basis of developing deeper bonds and ultimately trust.
In that vein, actually, I would just add, psychiatrically speaking, you would expect people who either have a terrible loss, many patients who have been hospitalized during this time and lived, but were in an ICU for a lengthy period of time, and healthcare professionals who have, gone through, extraordinary circumstances to experience at least an acute stress reaction after this time period. And what is heartening to know in some ways is that the more social interaction and support essentially that someone can get while they're experiencing an acute stress reaction, it diminishes the likelihood that that goes on to become post-traumatic stress disorder, which is something, you know, we talk about it, we will be talking about, and certainly some people will go on, but it really is actually a small percentage. We talk a lot about it, and so people feel like, well, naturally everybody will get PTSD, but that is unlikely to be the case. Some people will, but really the more social support and aid that people get during that difficult time, which essentially starts now. People are coming out of the hospital now. Doctors are online now. The less likelihood that that develops into a more difficult problem that, again, still can respond to treatment, but something that should be, I think, addressed now.
A question just came in, Gail, about what recommendations do we have for setting and implementing a routine for working at home with a healthy work-life balance? Great question. There's obviously no easy formula for that, but I having spent 12 hours a day on Zoom or the phone every day this week, if not more than that, for the past couple of weeks, which I'd never done before. It is grueling. And so I think that pacing oneself, just because one has access to a computer and can talk for 12 hours a day, doesn't mean it's a good idea to do. It's a terrible idea, actually. So I would take breaks. I would limit that. I would walk around. I think now, if ever, is a time for a measure of greater tolerance of the fact that people have complicated and different circumstances at home. Some people are home alone or dealing with the emotional consequences of isolation. Other people are home with young kids and are trying to juggle educating and just taking care of young kids while also working. Other people are living with too many people in close quarters, but of course there's nothing that can be done about that now. And so that can precipitate tensions within relationships, a whole variety of many permutations of the stresses of being at home. I do think that being on some kind of regular schedule, as Gail and I have both said, is important. I think that limiting the intake of news, I'm a news junkie, but I've found that it's just too much. I would recommend picking one or maybe two credible sources of information and checking them once or twice a day, and that is it. I would resist the temptation to get sucked into the social media maelstrom for a couple of reasons. One is because it inadvertently fuels anxiety, even if it feels like it's a way of just staying in touch. And frankly, there's a lot of misinformation that's being sent around too. So pick one or two sources of information, check them sparingly. And actually resist the temptation also to forward the latest article to your friend that you've seen that you think might be of interest. Even if it is kind of interesting, I would not do it. I just wouldn't do it, because what's interesting to you is just going to fuel someone else's anxiety or not helping. So sorry to sound strong about that, but I would really resist those temptations. And also, don't keep your feelings to yourself. Doctors or healthcare professionals are typically rather on the self-reliant end of the spectrum, and that's great under ordinary circumstances. But now's the time that it's okay to be a little bit more vulnerable. And if you're feeling isolated or lonely or anxious, depressed, whatever, pick someone close to you who you trust and open up, even if it's doing a lot more opening up than you would do with that person. And just talking about it in that way, I think, can be enormously helpful and relieving of the burden that you're having to contend with this on your own.
I would just add to that that injecting a certain amount of forced relaxation, if you will, into your day is really important. Those news alerts, they give you a ping, they give you a little adrenaline rush, and it sort of cumulatively, it can be hard to step back from being tremendously anxious if you just keep pinging yourself all day long with news. Injecting slow, deep abdominal breathing, using an app like Calm or Headspace to help you do that in a guided way, to use visual imagery to a place that you frankly wish you were, that you find beautiful and relaxing, using muscle relaxation, tensing muscle groups to a count of 5, and then releasing them slowly to a count of 5, taking a warm bath, definitely aerobic exercise. 30 minutes of aerobic exercise a day goes head to head with antidepressants for mild to moderate depression, definitely reduces anxiety, definitely can make a difference during your day. But I would insert these things into your day, sort of morning, midday, late day, to sort of try to prevent the accumulation of anxiety that tends to occur over the day. A pediatrician has asked, how do you talk to children about what's going on? And this is really important because not only for the health and well-being of your children, but also of yourself, because as children become extremely anxious, and by the way, up to a quarter of all children at some point will have an anxiety disorder. There is, it is not unusual to feel incredibly anxious already as a child. But when children become, really overwrought with anxiety and behaviorally act out as a result, et cetera, it makes it much more difficult for the parent as well to contain their own anxiety. So I would suggest that the first thing is self-care, because no matter how many times you say to your child, don't be worried, if you seem completely overwrought with anxiety behaviorally, at the same time you're telling them something that sounds entirely different, that they should relax, that's not viable by any child. So it is important to take care of yourself. And then you want to basically, obviously, explain to them in very general terms what's going on. But what's most important to a child is that you are telling them that you are okay, and together as a family, you will be okay, that you've done your problem solving for how to protect yourselves, and that obviously, as an adult, and this is the source of anxiety for all of you, that there is not a 100% certainty, but that is not something that is helpful to really explain to a child. And by the way, let me just say, we don't have 100% certainty about most things in our lives. We just don't think about them, and they don't feel stuck as thoughts in our minds in the same way. And so to some degree, that is how you're presenting it to your child, as you've done your problem solving, you feel that you and they are safe, you're together, you love each other, you're going to ride this out and stay safe. And as long as your child essentially reads from you that you feel that way and that they feel protected and okay with you, they're actually going to be able to contain, I think, manage or not have their anxiety really get up there. But as they do, they'll want to come with questions. They'll ask you things. It's okay to say, I don't know, because there are a lot of I don't knows in this case. I think it's really important after children understand what's going on, that you engage them in the task of setting up structure in your home. You want them to go to school. You want to set up a work area for them to do that. You want them to have interjected playtime. How can we set up a structure for you to have some playtime within the house? You want them to socialize with friends. Can they talk on the phone? Can they be on the computer? Can there be a Zoom play date? This is a chance for your children to get creative with you in setting up structures for them that actually will really help them with their mental health in all of this.
Let me just add, I think it's really solid advice on dealing with children. It's a complex issue. I would just add, Gail, that there are a number of online resources that I would direct our listeners to on this topic, because it depends on the chronological age and the emotional age, really, of the child. A young child is you're going to talk to them differently than you're going to talk to an adolescent. And so I would recommend that people go there to some of the prominent mental health association websites, the American Psychoanalytic Association, the American Psychiatric Association, the American Psychological Association, and Psychology Today, the magazine's website. Those are the 4 that I would recommend, or the 4 that I've spent some time on. They're all chock full of really solid information, very consistent with one another. So highly recommend that. A couple other questions have come in. Give some brief answers here. I think that one question, which is really interesting to me, is about somebody who talks about feeling bored and somewhat depressed, and while remote communications are better than nothing, really missing that hug they get from friends and family. Such an important question, because we have never had we've certainly never done a grand social experiment before depriving people of human touch, but that's happening now. And I think that the consequences of the absence of touch are significant, and we don't really know what that's going to do. There aren't alternatives to it right now. But again, I think people need to be tuned into the fact that they are deprived of that. We can't kid ourselves that talking on Zoom is a complete substitute for that. I wish I had a better answer to that question, but well, I don't.
One thing I would say is that we can't necessarily replace touch, but there is such a power in words and expressions of feeling, and often that is what a touch is. That is, I mean, a hug is, I love you, and I care for you, and I want to comfort you, and even though you can't replace that, and that is definitely a loss, sometimes we don't use words at a deeper level. We're embarrassed, we're uncomfortable. It's easier to do it physically. It doesn't come as naturally. But when you do use words like, I feel so badly that you're feeling this upset. Even saying, I wish I could hold you and comfort you, and I feel these various things about you and what you mean to me. Basically injecting meaningfulness into the relationship. That goes a long way.
Yeah. And that may be, by the way, I think you're right, Gail, and I think that trying to look for a few silver linings in this experience that we're all going through together, we need to, first of all, we need to go through it as a community, and I think we can use that kind of language when speaking with each other in ways that may actually strengthen us as the different communities that we belong to. And I think if one of the things that comes out of this is that people learn to make themselves more vulnerable about expressing their own feelings to other, that would be a good thing. So let's hope that comes from this. There are some other questions here that are at a sort of different, that are more organizational, that maybe we can touch on briefly. Some strategies being used or recommended in organizations for staff directly impacted by personal loss and personal grief and anxiety. Complicated set of issues there, but yes, there are already a lot of losses, and there will be more. And of course, some of our typical ways of dealing with grief, like going to a funeral, frankly, is not possible now. So major aspects of living are unfortunately being put on hold. Part of living is honoring those who we have lost, and so we're going to have to be very creative about that. I think there'll be a lot of memorial services when the restrictions on physical distance are removed. But right now we're going to have to bear some of these feelings without the shared experience of going to those kinds of memorial services. But we need to be acknowledging how hard it is to not have them. Another question, someone supervises teams of nurses in a clinical setting as well as in an academic setting, people demonstrating signs of trauma but aren't necessarily recognizing it in themselves or communicating it to the supervisor. They've offered resources, but people haven't, I'm paraphrasing the question, but people haven't taken up those resources. How can better support them? Really good question. When supervisors have meetings with the people that work for them, again, those meetings, whether they are held in person in a hospital setting, people who are essential workers who are physically there, or when they connect with them virtually later, ask everybody, before you get into talking about the work issues, ask each person how they're doing, just a quick check-in. It can be just a minute or two, but let people talk about it. And if you pick up on somebody, again, I'm not trying to turn everybody into a psychiatrist here, but if you pick up on somebody who seems to be struggling and maybe even lets on a little bit when you're talking with them in a group setting, then follow up one-on-one afterwards because of course they may be more comfortable opening up privately about how they're personally struggling. I think we can't wait or expect to wait for people to seek help all the time on their own. Of course, some people will do that, and that's great, and we want to encourage that. But I think people who are in supervisory roles need to be really tuned into the emotional needs of the people that they are supervising, and don't be shy about suggesting that somebody get more treatment or get some active help.
One person asks about, and I'm hearing a lot of this. This is, I think, a real problem when it comes to anxiety and how anxiety physiologically manifests itself, is that some people are feeling, am I anxious or do I have COVID? And the reason for that is that there's a lot of overlap of symptomatology. Feeling anxious is a physiologic experience in addition to having worried thoughts. And in fact, interestingly, anxiety really, from a neuroscience standpoint, is the body having an anxious response and then the mind attaching a thought to it. So we often do experience something physical. It just happens so quickly that it seems as though we thought the thought and then we have the physical response. But basically, people who are experiencing anxiety have often shortness of breath, chest palpitations, nausea, they have a chest tightness, they may have sweating. So all of those things are things that they may be hearing also about the experience potentially of having COVID, and that can make it concerning. But certainly one does not have fever with anxiety. That is definitely a differentiator. And it's also important to know that one doesn't typically, unless very rarely in certain hysterical sort of situations or situations where one has had a suggestibility and keeps thinking about cough, but generally, if you have a cough and a fever with whatever else these symptoms are, then you're more likely to be, you would be right to be more concerned that this is a viral syndrome. It is important. Why is it important? Because in fact, nobody wants people going to the hospital unless they really need, they're severely ill with COVID and really need to be in the hospital for breathing problems, essentially. And so I'm just going to throw another suggestion out there, which is I've been hearing from patients who are having a lot of symptoms, and anxious people can be very suggestible. When you start thinking, could this be the virus? You may start feeling a lot of the things that feel like you're virally ill. And then you start thinking, am I short of breath? Should I go to the hospital? And that can make you feel more short of breath, even if it's just anxiety, but it's a real response because our minds and bodies are connected. So you are really feeling short of breath. One thing that you can do is there actually is an app called Pulse Oximeter. You can download it on your phone. You can actually check your oxygen level if you're feeling particularly anxious. And as long as your oxygenation is above like 95%, you are fine. You are not having a problem. It is the people that are dipping below that and even well below that that are having an issue going on. And I normally wouldn't throw something like that out there, but so many people are experiencing these physiologic anxiety issues that they're feeling confused about what might be going on with them.
I think, yeah, you'll do the next one. We may have time for one more question before we're going to have to wrap up pretty soon. But this question is, my work includes working with vulnerable, undocumented, and refugee communities, and the anxiety is extremely high. What strategies, coping strategies to share with these populations? Tough one, but a very real problem. First of all, take care of yourself when you're working, because I think that, you know, being able to take care of others who are so vulnerable, you need to be making sure that you're holding up reasonably well and keeping healthy to be able to help others. Look, these vulnerable populations are as deserving as anyone else of the care that we're trying to give and to receive, and those populations need help. They need the same physical distancing and medical attention and so on. They also need advocacy on their behalf, because that was the point that I was trying to make in my opening comments about anxiety, that sometimes when we're so anxious, we just think about ourselves or those who are immediately around us, and don't give as much attention to those in these populations that this questioner is asking about, refugees, undocumented people in our countries. And the reason why I think this is such an important question, and I wish, again, I had a good pat answer, but I certainly don't, is that it is so important to take care of them, A, because they have a right to care like anyone else, but B, I think that the way we conduct ourselves as healthcare professionals, just as citizens of the world right now, is this is a defining moment for us as individuals and as society, and we will be judged by whether or not we took care not only of ourselves and our immediate friends and colleagues and patients, but of those for whom care is much less accessible, or who live in conditions that are really difficult. And so, this is a time for being moral and doing what's right. And we need to see moral leadership. We need to see our leaders, and we can step into the leadership breaches when they occur. Make sure that these vulnerable populations get as good a care as we do.
If there's time, I can answer one more question, because I do think this is not the same type of vulnerable population that Kerry was just speaking of, but many people in this country already were struggling with a mental health issue. And that group is particularly vulnerable at this time. We know that pretty much anyone who has almost any mental health diagnosis is made worse by high stress. And it doesn't get a lot more stressful than this. And many people suffer in silence already because of stigma, because they feel they can't afford treatment, they shouldn't go to treatment. And even if they are getting treatment, they may have arrived at a better place, but this kind of an occurrence is making it, is making people who are already struggling generally much more symptomatic, some groups more than others, but across the board, I think most of us are hearing from patients that we maybe even haven't heard from a long time. And so I think that we need to think about the kind of support that will be available, even ongoing, for people with mental health issues, because they definitely will need not only the support now, but certainly afterwards in a more ongoing way. And again, the silver lining may be that we open up many more channels to mental health care than we currently have available, that we make many more people aware of mental health care that is available to them and that can be available to them, so that they continue to partake of it even after this ends.
Looks like Donna is back.
I'm back. Great. That was, thank you so much for taking us through this almost last hour. As Dr. Sulkowicz said, we need to go through this as a community, and I really appreciate you sharing your expertise, both of you, with us. I think some of the things you said we've heard before, but it's really good to get a reminder, because we may not be practicing what we know we should be doing, and other things that we heard today were new to some of us. So we're really, really grateful. I just want to close by thanking everyone for being on the call and just sharing with you our priorities at PHR in the face of this monumental challenge. Is first to make sure that the firsthand expertise and insights of scientists and health professionals take center stage to guide the world's response. We, and many of you are on this call, we at PHR will do everything in our power to elevate these voices in decisions at all levels, and also to call for transparency by governments and hospitals and the healthcare sector. This really is a team effort, and health professionals have to play a key role in leadership, and they have everything at stake. So we at PHR will continue to be a go-to source by the media, policymakers, NGOs, and others for the medical expertise, and that unique lane that PHR has been in for over 3 decades, that intersection of health and human rights, especially as this pandemic will affect the most vulnerable in society disproportionately, as we just discussed in the last question. A lot can be done in the coming weeks. It's a very urgent time to act. And we can make a difference by getting in front of some of these critical issues. We will continue to advocate for PPE, personal protective equipment, standing with health professionals who are speaking out for their own protection, and those living in conditions where we just heard freedom of movement is constricted, such as immigrant detention centers, refugee camps, prisons, and other places. So if you don't already follow us to receive our e-updates, go to our website and sign up. And even though Kerry said that we should not be checking social media, you should be receiving PHR social media, because there are actions there that you can take, and it'll make you feel good and it'll do good. So we really hope you'll join us. And Dr. Sulkowicz and Dr. Saltz, thank you so much for the session today.
Thanks for having us.
Thanks for having us.